In terms of bench test preparation, bench test was like the scariest thing. Not prepared. The first year, one of the two interviews that I got was from UT San Antonio Health Science Center, and it. So I went there, and of course, as you know, I didn't make it in, but I was totally not prepared. And I didn't really know what I was doing, I guess. It was, I don't know. The prep time was short. I wasn't expecting to get an interview, so I wasn't preparing beforehand at all. Like that interview I was like one of the latest batches, which was like in November, late October or early November, something like that. So it was very late. I had already given up hope, and I was actually already studying for the Part 2 boards at the time. So I was almost like, well, should I even go for it? I don't have any instruments. I don't even know what instruments to buy. And where a lot of you guys are at probably that I don't know what to do kind of stage. And I went from there to second year really jumping leaps and bounds in terms of my hand skills, my preparation, into a place that really I didn't think I was capable of doing. Um, I I did not think that I would be able to execute what I did at the time, like even till today. The things that I practiced at the time still stay with me, and it's really so. I guess what I want you to know is what you're doing right now is much more than just preparing for a bench test. It's more like you're learning things that will stay with you for the your entire career. So in terms of teeth preparation, important thing. In dentistry, a millimeter is a mile, and yeah, a millimeter is a mile, and that is just it just goes a long way. It's just a lot to yeah, I mean, as the slightest slip of your hands will ruin the preparation you're so um you put so much energy into that looked pretty good. You can completely turn things around with the slightest slip of your handpiece. A millimeter error is like huge. So when it comes to mistakes, there are two types of mistakes in the admissions eyes. Um, there are deal breaker mistakes versus, I shouldn't say minor, but less deal breaker mistakes. So deal breaker mistakes is when a mistake that is made will actually lead to, so if you imagine the typodont being a patient, a deal breaker mistake is when the mistake an applicant made is actually going to lead to a compromised restoration or a failed restoration. So if you did this on a patient, the longevity of what you did is going to be significantly compromised due to a error that you made. So there are deal breaker mistakes and versus there are minor mistakes. Minor mistakes are still not that good for bench tests, of course, because we're trying to be really, really precise here. But minor mistakes are things that are not the best, but if a restoration is done well, the patient could still be okay. Like a preparation like that could happen if a patient had huge decay or caries that were big from the get-go. But um, but the longevity of the so it's not as major of a mistake as the deal breaker mistakes were. Um, from somebody that is so from the applicant's eyes, usually most applicants don't know how to tell those two apart and don't know how to tell even a lot of mistakes is one thing I notice over and over again as a challenge for many of the applicants is that their eyes are not trained. Um, if your eyes are not trained to identify, especially the deal breaker mistakes and the minor mistakes, we don't know where to start because you can't self-critique your work. If you can't self-critique your work, you don't know what to do to improve it. And this is huge. And usually the most mistakes that are easier to identify are minor mistakes. They're not deal breaker mistakes. So I want you to keep this in mind. The mistakes that you see made are often going to be minor mistakes, and a lot of mistakes you and if that's you, then you're probably not identifying the deal breaker mistakes at all. So so that's basically why I wanted to put a presentation together around this so that you're all better prepared. Okay, so let's start into mistake number one. Mistake number one, when we do preparations, amalgam, mostly amalgam, composite, less significant. We all know that it has to converge. We know that in our head, but do you really know how to identify it? That would be my question. Because it's so easy to read about it, but this is a mistake that I see in 70% of the time for my online intensive students or students that I coached in person when they're here. Um, this is something that I have to point out over and over and over again, even to the same student, because the student will, after I point it out to them, they'll say, "Oh, I see," but they didn't really train their eyes just yet, so they make that mistake again and again and again. Let's take a look at this prep. Well, it does have some mistakes, but overall it's pretty clean. It's all right, right? A huge mistake that this preparation made will be revealed right here. I hope you guys can see this. On the um, on the occlusal portion of the buccal wall, it's not converging in, it's actually diverging out. So this wall, this is a major issue, because what happens is amalgam only stays in place because of the physical mechanical retention, um, which comes from convergence. If you don't converge an amalgam preparation, the amalgam is not going to stick in at all. It's just going to fall out, right? We all know that, but yet we usually make a lot of mistakes in the convergence. The box is usually easier. I see that students make less mistakes in the box and more in the occlusal segment of the class 2 amalgam preparation. So keep that in mind. Always make sure that there's a visible convergence, especially for amalgam preparations, in your preparation. So if you go back, like, it's something that, usually our eyes go straight to the outline and things like that, and maybe that, like, there are other things that can be talked about, but um, but convergence is usually not what is going to be mentioned, and it's a big issue. Mistake number two comes from the contacts of the box. The contacts, I mean, it's hard. The contacts have to be just right, right? It can't be too much, it can't be too little. So if you look at this, the buccal is acceptable. I mean, it's acceptable. This preparation, the gingival is fine. The lingual, barely. The buccal is not. It's not enough. So again, this is not open. So depending on who grades you, this is going to be like not open enough. But let's look at this one. I think we not heated now, um, it's okay. The reason we want. Great. Okay. So I'm going to get started again from mistake number 2 because I'm not exactly sure where I left off. So let me pull that out. Okay. So mistake number 2 is the contacts. So if you look at this picture, I do think most of you guys were present, and I think I was still connected when we were doing this. But just to go through one more time to refresh your memory, the second mistake is regarding the contacts when you do a class 2 preparation. And class 2 preparations they're really, really hard. They're not easy. In my opinion, I don't know, just personally, this is like one of the most difficult things to do, especially when the typorant is mounted. And so the contact is, in the beginning, people tend to open it up pretty big. The contact tends to be open and wide, and then as applicants practice more and more, they tend to make it too conservative, and as they know how to break the contacts less and less and less, oftentimes they leave behind a not open contact, which is a big mistake. You don't want to do that. So if you look at this premolar here, the buccal side contact is not open enough. The lingual side contact, it could also be open more. The gingival contact is good. It's open. You want to make sure that it is visibly open. So that's that. As long as, so depending on the degree, like this one right here, this is a minor mistake. It's not like a deal breaker mistake, okay? But when it comes to this, now this is where a lot of people stumble or make the wrong decisions. So when something like this happens, do you see this enamel lip hanging out like that? This enamel lip is a deal breaker. Oftentimes I see students wanting to leave this behind because if they get rid of this, their contact is too wide open, and being, you want to be conservative as possible, so you leave this behind. But the thing is, you already over-prepped it in the middle of the box on the buccal wall right there. And if you do that, you have to open this up. You have to make a compromise. You're already making a compromise. When you make a compromise, it's important that you make the correct compromise that is more acceptable. If you think about it, a contact can be wide open if the patient came in with large caries, right? So it is possible to make a good restoration with a wide open contact. What is not acceptable is unsupported enamel staying behind, because if we make a restoration there and the unsupported enamel chips away, basically now the restoration failed. And hopefully that patient will come back to get it replaced, but oftentimes they might not until, it becomes pretty bad. So, yeah. Always think about that. So if you do run into this, make the better compromise you can, and open it up more. You have to do it.
I'm going to test again. Let me know if you can hear me. We're going to try a different mic. We're dealing with some internet issues, but I appreciate you guys bearing with us. Hopefully this will be a little more reliable and break up less. So we'll just keep on trying our best. So again, give me a chat that you can see this, or a little text that you can hear this at least and see everything pretty soon. Thanks.
Okay, so let's move over to mistake number 3 now. Mistake number 3 is your margins. So much to do with your margins, right? They're wide, they're narrow, they're whatever. They're not following the contour of the gingiva. There's a lot to do with the margins. But what I wanted to bring up, because it commonly is overlooked, is a lip. And this happens most often interproximally. Do you see this dipping down and coming up again a little bit? Not so much on this side. This is overall, it's a pretty nice looking canine preparation, would you agree? But look at this. If you make a crown on that and this chips off, your crown failed. It doesn't matter how nice everything else is prepped. So this is another one of the deal-breaking mistakes that you don't want to make. And this doesn't happen too often when you're working benchtop. This really happens only when you are working mounted. And when you are able to take it out, like, when you're working at home on a mounted typewriter and you take out the typewriter and look at it, then you realize you have that lip. But the difficult thing is identifying it when it is still mounted, because you're not going to have a chance to touch it if you're not going to have the chance to check your work, unmount it, and then check your work. So unfortunately, this will have to be identified on the typewriter. And the way you want to do it is, first you want to make sure that you see gingiva interproximally and all the way around. It's pretty wide open. And then when you try to pass your explorer through the contacts of the crown preparation, that you can actually, it's free. If there's any binding at all, it means that that means there's something going on there. If you think about it, the reason, there's several reasons that the margin interproximally is important. One of them is that it is because it's unsupported enamel that will chip away, that will lead to a crown open margin. But another one is that it's because if we don't have sufficient space to take an impression to send to the lab cannot make a good restoration back for us. So if your explorer cannot pass freely between the adjacent tooth in a crown preparation, that's not enough space even for the light body. The light body will tear as you take out the impression, and basically for the lab has to do guesswork. And in private practice, yeah, that happens all the time, but it's absolutely not acceptable for bench tests at all. So that turning up of a lip is one thing from the margin that's huge. Another thing from the margins, central incisor preparation. Pretty nice, right? You see a nice tooth plane reduction and pretty good. But if you look at the margin interproximally, especially in the distal, it's very supragingival. So basically, the margin was following the contour of the gingiva nicely until it went interproximally. Now interproximally, it's like 2 millimeters supragingival, and it's very, very easy to miss this. I see this happen all the time. So yeah, the enamel lip is a deal breaker. It really is a deal breaker. The second one is not a deal breaker. It's a rather minor one, but still, you don't want to do it. Okay, so this is a deal breaker. This is not a deal breaker, but it doesn't look very good. Okay, and it's definitely not within the guidelines of what schools want, right? Because the schools want the margins to be uniformly. Most of the schools will say between 0.5 to 1 millimeter supragingivally, and especially on distal, this is definitely more than 1 millimeter. Mistake number 4. Your undercuts in the crown preparations. And I know this is easy to hear, But the question is, do you identify it? Are you knowing that you're making it? Especially where I see it the most often is central incisor or the canines, labially and palatally. This is a crown preparation, a central incisor. And I mean, it's pretty nicely done. It really is. It's pretty clean. But if you look at these walls from the labial and the lingual walls, do you see this? The lingual wall, the direction of the lingual wall is not correct. Therefore, these two walls right now are forming undercuts. They're not converging up. They need to. Um, sorry, it's diverging. But it formed an undercut. If you make a preparation like this, then basically you can't, it's impossible to make a nice fitting crown, right? The crown, yeah, it's just not possible to make it. The lab will have to block out a huge amount onto the up onto the margins, and that crown is not going to last very long. Well, that's what you do in private practice. When you're in school, you redo it, and it is a deal breaker. This is an absolute deal breaker in terms of your bench test and your performance in school. It's not acceptable. So the labial and the lingual wall directions they must taper in without a undercut. Also, let me see if I have. Okay, also another one that happens all the time is the direction of the labial wall. This is barely acceptable in terms of direction, but I do see a lot of people that will bring it in more. So basically, they're either trying to do one or two things. They're trying to pronunciate the two-plane reduction by making the degrees between the angles big, so that it's pretty, it's really, really obvious that it's a two-plane reduction, or they just don't know. But the thing is, if you think about what the tooth looks like, the tooth will look like this. It converges in, there's a cervical constriction, right? Cervical constriction, when you prep the crown, if you keep the tip of the crown touching the tooth when you start prepping it, you're direct to see a triangular space between your crown and the tooth. So basically, the side of your tooth should be touching the gingival third, like kind of the junction between the gingival third and the middle third of the tooth, and you should not be focusing on the tip area just yet when you start making that, and that will be really the only way to avoid making a undercut on the labial. So it happens often both ways, labial and palatally. So beware of both of them. You don't want to make an undercut in both of them, and actually both happens the same way. This happens because the burr is tilted in too much this way. This happens because the burr is tilted in too much this way. Okay. So that will be in terms of undercuts. And undercuts also can happen in posterior crowns too. They're a little more easier to identify, but the areas to be most careful of is going to be your line angles. Around where your line angles are, there's a lot of tooth structure to remove. It's just natural because we're trying to make, fit in a crown on top of something that was bulging up. We're reversing the anatomy in a sense, right? And it's most prominent, and a lot of tooth structure needs to go away on the line angles. So what happens often is, because you want to keep things conservative, you try to take away as little as you can while making an undercut in that area. So you kind of make a margin, but you don't reduce enough in the body of it. You make an undercut. So if your crown looks square, you want to revisit that area. And another one of the deal breaker mistakes that, if you have to choose between which compromise to make, this is very, very important to choose the right compromise versus the wrong compromise to make, is if you're not sure if there's an undercut, over taper it just a little bit. You have some leeway between the taper, And it is better to over taper because an over tapered crown, I mean, if it's over tapered, you can still make a crown over it and have it fit. If it's an undercut, you cannot make a crown on it, right? So if there's any doubt, over tapering is definitely more, I mean, you don't want to do it, but it's more desirable than a undercut is. Okay. The last mistake, please know where to stop. This happens so often, all the time, and it's the most frustrating thing that can ever happen is you fiddle with your preparation. You keep on fiddling because it's not perfect. You know where it's not perfect, and you just want to do a little bit of this, and you just want to do a little bit of that, and then you end up making a mistake. You slip your handpiece, and you make a big mistake that's now you can't really do anything about it, and you basically ruined it. Because you didn't stop when you should have. And this is really hard to do. But you do have to know where your comfort level is. And this really extends into all of dentistry, right? You have to know when to refer a patient out to a specialist, where you should, what kind of cases you should take on and not take on in terms of ideal preparations. You have to know, if you practiced enough, you will get a sense of it, like, oh, I made this mistake often, and every time I tried to correct this, I slipped my handpiece, and I ruined something. Right now, is it worth it to do it or not? And please, guys, don't press on the foot pedal unless you are 100% sure what you're doing is what you want to do. Repeat myself. This is the one biggest thing. If I can say anything to you today, do not prep unless you are 100% sure that what you're prepping is what you actually want to do. And there's a lot of frustration around preparations. It's really hard. I mean, treating a millimeter like a mile is like, it's easier said than done. The thing is, the high-speed handpiece will reduce your tooth structure so fast. And if you're just off just a little bit, you already ruined it. Go as slow as you can. I mean, within the time limits, of course, but if you have any doubt where your handpiece is and your burr is, if you have any doubt whether the burr is at the correct location or not, please don't step on that handpiece. Don't hope that what you did will be the correct thing, because oftentimes it's not. Okay, so I got a lot of requested cover number 2 again, so let's go back. Mistake number 2 was regarding contacts for class 2 preparations. There are a lot of things that can happen with contacts. It can be too much, open too little. Yeah, basically those are the biggest 2 things, leaving a lip of unsupported enamel behind. So that. This is an example of a contact that is not open enough, especially on the buccal side, as an amalgam preparation. The amalgam preparation needs to have visibly open contacts, no doubt. For composites, it's less as open, but amalgams, you want it visibly open, unless it's, one of those exception areas where for aesthetic reasons we make exceptions. But this is a second premolar DO. This is not aesthetic area. If you leave this behind like this, some people will consider it barely open. Some people will actually consider this closed. And if you have a closed contact, what does that mean? That means that it's going to be really hard to restore it. Like, you need space for your instruments to get inside there and really shave off the margins, so that the margin between the amalgam and the tooth structure becomes completely flush, so you have a really nice restoration. If this is too close like this, you don't have space for that. Therefore, your resulting restoration is compromised. So it's much better to have it open than this. Lingual can be a little more open. Buccal definitely needs to be more open. But this one is a small mistake. The real deal with breaking mistakes is this one. this slip of unsupported enamel that's left behind, this wave, you see, this curl, the box should not have any curls, okay? If you have a curl in your box that goes inward like this, you have to get rid of this. And a lot of people don't want to get rid of this because this is going to open up their box too much. The thing is, you already over prepped here. Ideally, this would have come right here, right? Ideally, we would get this tooth structure back and open it up still a little bit more than this, but yeah, ideally we would get this structure back. That's impossible. You already made a mistake. At that point, you have to make a compromise, and you have to choose which compromise to make. And you have to choose between which compromise to make. In this case, the operator chose to leave this behind. This was a mistake. What needed to happen was to open it up more. And I know that this starts heartbreaking because you want to really leave this nice little contact, area behind, but you can't do that. The thing is, if you leave unsupported enamel behind, if you restore this tooth, then this will break off very, very soon. It's a first molar, it's under a lot of pressure. It's one of the biggest chewing teeth, and if this breaks off, you're lucky if the patient comes back for a replacement, but often patients don't come back. And yeah, so basically that is a failed restoration. So and also keep in mind that patients can, and contacts can end up very, very wide if the caries were deep. So it is in a sense slightly more justifiable. But if you do it the other way, where you leave this behind, this is going to fail. So you have to, think about why we do what we do and make the best compromises possible.